The process of conducting therapy session. Good afternoon, everyone. Today we will be discussing the process of conducting therapy sessions from start to finish. Therapy plays a crucial role in mental health and overall well-being. It provides a space for individuals to gain insights into their experience, understand their emotions better, and develop healthy coping strategies. Therapy can help with a wide range of concerns like anxiety, depression, trauma, and relationship issues. Professional competence is vital for effective therapy. Therapists must possess the necessary knowledge, skills, and expertise in their chosen therapeutic approach. They should continue to engage in continuing education and adhere to ethical guidelines to ensure the highest quality of care. According to the National Association of Social Workers, it is important to adhere to the boundaries of their education, training, licenses, certification, consultation received, supervised experience, or other pertinent professional experiences when offering services and presenting themselves as competent. The key stages of therapy typically includes relationship building, assessment and diagnosis, formulation of goals, intervention and problem solving, and termination and follow-up. Each stage serves as a specific purpose in a therapeutic process, promoting self-discovery, personal growth, and healing. A well-structured approach ensures that clients receive the necessary support and guidance. Throughout this presentation, we will cover the key features of the therapy process and how to effectively navigate each stage. The 5 stages of therapy overview. The first stage is relationship building. It is the initial stage of therapy where the therapist and the client establish trust, a rapport, and a safe therapeutic alliance. This stage focuses on creating a supportive and non-judgmental environment where the client feels comfortable sharing their thoughts and emotions. The second stage is assessment and diagnosis, which involves gathering comprehensive information about the client's background, history, and current concerns. The therapist uses various assessment tools and techniques to evaluate mental health, identify strengths and vulnerabilities, and diagnose any psychological conditions that may be present. The third is formulation of therapy goals. It is a collaborative process between the therapist and the client. Together, they establish clear and achievable objectives for therapy based on the client's needs and desires outcomes. This stage helps ensure that therapy is targeted and focused, providing a roadmap for progress and growth. The fourth is intervention and problem solving, which involves implementing therapeutic techniques and interventions tailored to the client's unique needs. The therapist helps clients explore and process their thoughts, emotions, behaviors, offering support, guidance, and tools to develop healthier coping strategies and solutions to their challenges. The fifth and final stage is termination follow-up, which occurs when therapy nears its end. The therapist and the client reflect on the progress made, celebrate their achievements, address any lingering concerns, and create a plan for maintaining progress outside of therapy. Follow-up sessions may also be scheduled to ensure continued support and address any future issues that may arise. Relationship building. The therapeutic relationship building between the client and therapist is widely recognized as one of the most crucial factors for ensuring successful psychotherapy. In fact, it is regarded as the best and most dependable indicator of the therapy's outcome. Excuse me. The therapist aims to build a strong therapeutic alliance with the client. It involves creating a safe and supportive environment where the client feels comfortable sharing their thoughts and feelings. Building rapport is crucial for trust and open communication throughout the therapy process. Assessment and diagnosis. There is a significant consensus that thorough assessment must be completed prior to proceeding with treatment. The assessment tradition in social worker utilizes two modern tools. the genogram, and the echo map as examples of the shift from diagnostic categorization to systematic contextualization. The therapists collect relevant information about the client's history, current concerns, and goals. This stage involves conducting assessments, interviews, and possibly using standardized measures to gain a comprehensive understanding of the client's needs and strengths. The assessment helps the therapist develop an individualized treatment plan. Formulation of therapy goals. The active phase of therapy where the therapist and the clients work together to address the identified issues and goals. The therapist applies evidence-based interventions and therapeutic techniques tailored to the client's need. An article in the Journal of Social Work Practices states in this stage, the therapist actively participates in the treatment process and collaborates with the client to construct their narrative. The emphasis is not solely on the therapist's insight and interpretation of the client's psychopathology, but rather on the potential for both client and clinician to experience change through their therapeutic interactions. Intervention and problem solving. Problem solving is an integral part of therapy where the therapist assists clients in identifying, setting goals, generating alternatives, evaluating, and implementing solutions. Through intervention and problem solving, therapists help clients overcome challenges, develop effective coping strategies, and work towards their desired outcomes. In an article in the Journal of Psychotherapy Integration, it states that problem-solving treatment is designed to help the client in learning how to identify problems, generate alternative solutions, select a solution tentatively, and afterwards test and verify the effectiveness of that solution. Termination and follow-up. The last stage of therapy involves reviewing progress, processing the client's experience, and preparing for the conclusion of therapy. Closure may include discussing the achievements and changes made during therapy, reviewing the client's skills and resources, and helping the client develop strategies for maintaining progress after the therapy ends. Follow-up sessions may be scheduled to provide additional support if needed. Conducting therapy sessions involves several key stages, and we'll review them. The first stage focuses on building a strong therapeutic relationship and establishing trust with the client. The next stage involves assessing and diagnosing the client's needs and goals. The third stage focuses on formulating therapy goals and actively implementing evidence-based interventions tailored to the client's need. The fourth stage is problem solving. It is an important aspect of therapy where the therapist assists clients in identifying, evaluating, and implementing solutions. And the last and final stage involves reviewing progress, preparing for termination, and providing follow-up support if necessary. And this concludes our presentation. Here's all the references. You can take a look at it, and I hope you enjoyed. Thank you.